My favorite job? Well, I don't have a favorite because they're all different. When I was acting head of the Department of Natural Resources, we opened the Inner Harbor, and I was able to build Euclid Beach into a state park. That was fun. Making things better and change was fun for me. And most of my jobs were short-term, but I enjoyed them all. It's hard to say which one I enjoyed the most. One could say I enjoyed this one the most because I've been here 15 years. All the other jobs were 6 months, 2 years, 3 years, and they were shorter term. But I enjoyed public service. I believe it's an honorable profession. And where else can a guy make a difference and change that affects so many people in our community? So I like that, and I like being a part of that. I think the important thing is that I made a difference, and it was better. My time was well spent, and it was better when I left. I think that would, I would like that. I'd like to be remembered for that. The whole idea was to deal with a person that has a dual diagnosis and has both diseases of addiction and mental illness, which is more than 50% of the people we deal with. And to have two different agencies deal with the same behavioral health, it's in the same family, we would be more efficient and save money. And we saved an awful lot of money. We had, at that time, payrolls totaling up 103 people. Today we have 46 people. We saved a tremendous amount of money and efficiency by coming together, but more importantly, we had the ability to deal more effectively with the diseases with a person who has multiple diseases of addiction and or mental illness. Well, first of all, let me talk about Valeria. She is going to do a great job. She is the right person at the right time, and you'll get a chance to meet her. She's brilliant in my mind, and I'm very, very proud of her. In terms of the opiate epidemic, I have two feelings, one of pride and one of a sense of loss, in that we really haven't conquered it, but we have done things differently. We listened to families, and they told us that their loved ones that they lost needed longer-term continuous care. And one of the things that we were doing in the beginning was putting them in detox, keep them for 30 days and send them home. And what happened is they go back to where they got addicted from and recycle back. By listening to them, we have really worked out a continuum of care that gives them the opportunity to stay longer and have other people help them deal with their disease, so they change their lifestyle and gain friends who have the same illness, which is very important, that they understand that it is achievable. We have really miracles happening every single day of people recovering, and I think knowing we could do it, having the resources to do it, is our biggest challenge, quite frankly. When you have a 800% increase in deaths and a 2% increase in capacity, that's going to be a problem. And I'm very proud that we have kept up to some point in terms of knowing what we have to do, and it's two parts. One is prevention, letting people know that this is a killer. It's not like you use it and you get drunk and you wake up the next morning. You don't wake up from this. It's one shot. It's that dangerous, and people die from it. So we need to get that prevention out. And for those that we save through naloxone and the Dawn program for mental health, we need to encourage them to take treatment. And we know that our first responders have the kit. But we've got to let folks know this is dangerous. It will kill them. And we need to have the beds so we could give them the long-term treatment so they could build that lifestyle that is absent the addiction. We figured out a way to have people work in multiple different disciplines and programs. And one is the halfway houses, and that we have a way to send them there without holding them to a regulatory standard that is not acceptable by them. But they are working, and the halfway houses are making it work. With our agencies, we now have introduced medical assisted treatment, which also works. So I think that what I'm proud of is that we have a balance of those that go into total sobriety and those that use medically assisted treatment, and that they both work, and that we have been able to achieve that balance when we need it the most right now. One of the things I'm proud of that I want to continue is a sense of urgency on making decisions and providing services, that the sense of urgency that the last phone call is made, that the last opportunity is dealt with, that this is not dealt with as something you could put off till tomorrow afternoon, that we need to continue dealing with this as an urgent emergency every single day, and I'm proud of that, and I'm proud of the team that I've been allowed to work with, and that they have embraced that sense of urgency. My sadness is that more people will die this year than ever before in our community, and I am really sad about that, and that Ohio will again lead the country in opiate addiction deaths. So the other part of me, I don't like leaving it that way, but I've learned that there are other people that are far more talented than I am that are here to do it, and I feel good about that. Well, besides thinking it's about time, there are other things I want to do. I was kiddingly saying earlier, I said, this job is taking me away from painting and writing and teaching, and that's what I want to do now, this next phase of my life. And I'll tell you what I'm going to be doing. I won't be getting up before 10 o'clock. I want to paint, continue painting. I want to write my story, and I want to teach at Cleveland State University. Those are the three things that I really plan on doing. I won't be home driving Mary crazy, but we will take some trips to visit grandchildren, which we adore doing, and leave everything open to see what happens. So I'm really looking forward to it. I know I've retired before, and I always wonder where I'm going to go next. God and opportunities provided. I'm not thinking of that right now. I'm thinking that I have 21 days left, and that what could I do in those 21 days that either I haven't done, that I have to do, and that I feel good doing it. So when I leave here, I'll leave with my head very high and feeling good about it. My advice to Valeria is keep her sense of commitment and compassion, and know that she has the skill to do amazing things. And I believe that she will. I think my advice to her is to be Valeria. She doesn't need to be me, and she doesn't need to be anybody else. She is a very unique, talented individual. My advice to her is be herself, because she has a tremendous amount to offer. But I believe she can do it. Valeria and I get to work together for this month. We have for the last couple of weeks. That doesn't happen all the time with somebody taking over a job like this. It didn't happen when I started. So I recognize the importance of letting people know how I feel about her placement, but also introducing her to people that she's going to be working with on a day-to-day basis. And you don't get that opportunity often. So this is an opportunity I don't want to see miss for herself and for me.